Respiratory number 3. The next test we're going to look at is doing a thoracentesis, and this is when a procedure is done when there's too much fluid in the pleural space. So that fluid is competing with the lungs' ability to expand, and therefore it's really making it hard to breathe for the patient. So what the physician will do is go in between the rib cage there, stick a needle in there, and actually drain that pleural space and of that fluid, and so they'll drain all the fluid out and then allow that the space to expand. There's another video that's attached to Canvas. It's really cool. It shows you a live patient getting a what we call a tap, which is a thoracentesis, meaning we tap the lung and remove the fluid. So it's kind of cool to watch that video and see that the relief on the patient side is instant. As soon as that fluid is out, the patient can breathe much, much easier. And then, of course, the physician will send off some of that fluid for cytology, just to ensure that it's not related to some kind of cancerous tumor. There's no guarantees if it comes back benign that it's not related to a tumor, but they do like to send out the fluid to be tested just in case, because many times if it is related to a tumor, cancerous tumor, it'll come back with the cancer cells being in the fluid as well. Next, we're going to look at the arterial blood gas values, or the ABGs. First, the partial pressure of oxygen measured. It measures the amount of oxygen dissolved in the blood, and as well as how well oxygen is able to move from the lungs into the blood. So we're looking at the PaO2 in this case. PaO2 looks at how well oxygen is able to move from the airspace of the lungs into the blood. Second, PaCO2 measures the amount of carbon dioxide in the blood, and therefore it measures how well we're able to move CO2 out of our body. Third is the pH, and we're literally measuring the hydrogen ions in the blood. And we, of course, want this to be between 7.35 to 7.45. Fourth is our bicarbonate, or HCO3 level. And our bicarb is a chemical buffer that keeps the pH from becoming too acidic or too basic. So by measuring the bicarbonate level, we're looking to see how well the blood is able to refrain from becoming too acidic or too basic. And then finally, our SpO2, or also known as O2 sats, or also known as oxygen saturation. What we're looking at with this is how much of the hemoglobin in our red blood cells is able to carry oxygen. Again, how much of the hemoglobin in the red blood cells is able to carry oxygen. The next topic we're going to go over is tuberculosis, and this is a chronic pulmonary infectious disease. It is transmitted, TB is transmitted through the air from person to person. So a patient will either cough, sneeze, speak, or sing, and it will literally be airborne. And patients who are nearby will breathe in this bacteria, and it will infect them. So this is a airborne infection, and therefore if a patient is got TB, they need to be on a reverse isolation room, meaning they have their own air conditioning and own ventilation system, and it's not connected to other patients in the hospital, so that this airborne and bacterial infection doesn't infect other patients. So what makes an organism droplet versus airborne precaution? Droplet precaution is when the bacteria doesn't survive long outside of the body. So that means it literally has to come in contact with someone else's nose, mouth, or mucous membranes, or conjunctiva to spread the bacteria. Airborne literally means that the bacteria is strong enough to survive in the air, and therefore all patients that are breathing in the same air will be at risk for catching that bacterial infection. If a patient is considered contact isolation instead of droplet precaution or airborne precaution, contact isolation means that you must come into physical contact with the infected patient or handling of the contaminated objects from the patient's room. So like mask, gown, gloves, anything from the patient's room that could have that bacterial infection on it. So looking further at TB, what makes a positive PPD? How do we know if a patient has been exposed to TB or actually has TB? So if a patient exposed to TB, which is the Mycobacterium tuberculosis, their skin will react to the antigens by developing a firm red bump at the site within 2 days. If a patient has a positive PPD test, that just says that a patient has been exposed to the TB germs during their lifetime. It does not mean that they have TB or they're contagious. Again, if we give a patient or another nurse a PPD test and their skin reacts to this PPD test due to the antigens in their body, meaning they have that red firm bump that is more than 10 large, then that means they have a positive PPD test. All that means is that at some point in their lifetime they came into contact with somebody who had TB. It does not mean that they have actively have the condition. So after we give a PPD test and it comes back positive, if we really believe that the patient has TB, in other words, they have chills, fever, night sweats, they have loss of weight, unexplained loss of weight, number one reason, and then of course the night sweats. If they have these signs and symptoms and they have a positive PPD test, then what the physician will do is order a chest x-ray. If the chest x-ray looks suspicious, then the physician will order the confirmative test, which is the acid-fast bacillus stain. That is the test that will determine whether or not a patient truly has TB. So they'll get the acid-fast bacillus stain or culture, and if they test positive on that, then they do in fact have TB. If they have TB, then they'll be put on an antibiotic cocktail, meaning it's 2 to 3 medications every month for at least 6 to 12 months after. And then, of course, we'll keep them in a reverse isolation room until they've been on the medications for 2 to 3 weeks. And then until we can say that we no longer consider them a risk of infecting those people around them. So please be aware that TB can be in a patient's body and yours as well for up to 50 years without becoming a problem. So it can live dormant in your body for 50 years. Usually if that happens, we'll see TB come out when either when the patient is got some other problem and their immune system is compromised. That's usually when, if it does live dormant in the body, will show its rear its ugly head, as they say. It's when your system is compromised with something else, and then your immune system is already taxied by doing its job with something else going on. So of the people who have dormant TB in their body, only about 10% will go active or live in their life. So again, that's it's a minor amount. So you just need to be aware that it can happen, and so we do want to educate families and patients who've had TB. Again, if we suspect a patient to have TB, we need to isolate them immediately if they're symptomatic and we suspect TB. So what signs and symptoms are we looking for? We're looking for coughing that lasts more than 3 weeks or longer, especially if they're coughing up blood. Again, there is loss of appetite and loss of weight, unexplained weight loss, chest pain, pain with breathing or coughing, fatigue, fever, night sweats, and chills. One of the medications that we put patients on is called rifampin. And we are going to teach our patients that the medications that they're taking for TB, they need to make sure that they complete the full dose up and that they don't stop taking it when they start to feel better. This is a regimen that they're going to have to take 6 to 12 months. If a patient does in fact have tuberculosis, then we can mandate that they be locked up in a hospital to be mandated to take these medications. It's not optional. It's one of the few times that the government can dictate if a patient has to take a medication or if they have to remain in a facility if they're non-compliant. One of the biggest challenges with having any kind of illness is if a patient's homeless. And therefore it can become challenging as medical staff to ensure that these individuals have access to being treated. And one of the ways that we get these individuals involved is have a place called a DOT, or a directly observed therapy. So this is a place where we actually can have them stay, and we have DOTs for TB treatment because, again, it is mandatory that patients go through the treatment because it can be a health nightmare for the government and can kill millions of people if it were to come out and start to spread. So if we have compliant patients who are homeless, one great way to get them to show up to take their medications every day is to offer a meal. So we've seen really great progress in the past. If again, if a homeless patient's willing to take the meds, they just don't have the means to buy them, then we'll provide them. And again, the way we get them to show up is to offer a free meal. So we want to make sure that we have, if you're taking care of a patient in a hospital that has TB, again, they're in a reverse isolation room. You, as the nurse, has to have a specially fitted mask called an N95 mask, N95. That is specifically fitted for you to ensure that none of the bacteria is inhaled while you're caring for that patient. Again, a positive PPD test is measured in 10 millimeters or higher. So the actual blood, not the redness around there that you're seeing on that screen there, but the actual raising of the blood has got to be 10 or more to be a actual positive PPD. Signs and symptoms of TB again include fatigue, malaise, anorexia, which is just weight loss, not wanting to eat, not having hunger, productive chronic cough, night sweat, hemoptysis, which is the blood in the sputum, low-grade temperature. You'll be on TB medications again 6 to 12 months. You are on bed rest until you are not showing any signs or symptoms. Again, we're going to have you on respiration isolation until we have a negative sputum culture. So until we get a negative acid-fast bacillus test back, you will not be released out into the public. Once we get that back, then you can go. All right. And this is it for this number 3. Thank you.